I often get asked this question, Munene, what are pre-existing and chronic conditions? Because a lot of you see them, see these words appearing in your medical policy, and you don't quite understand what that means. What are pre-existing and chronic conditions? So pre-existing conditions are ideally conditions that you had prior to joining the medical insurance cover or buying the medical insurance cover. Yeah, you were either diagnosed with this condition prior to signing up, or you've been treated. You've been going to hospital, seeing a doctor for a particular condition. So some of these conditions include diabetes, arthritis, hypertension, and these conditions are known to us. So prior to joining the cover, as the word even says, before, it was existing before signing up and joining the cover. And what are chronic conditions? Chronic conditions are conditions that have, first of all, no known cure. We do not know, there's no medical science that has found out a cure for this particular condition. It requires regular medication. So if you're hypertensive, you have diabetes, you're always on a monthly medication dose. So that is what we refer to as chronic condition. Now, a lot of insurance companies, not even a lot, all insurance companies will usually limit that benefit. So for that pre-existing and chronic condition, it will have a cap, or what we call a sub-limit. Say you have a 1 million inpatient cover and you get admitted for hypertension or high blood pressure. Your insurance company is not going to pay the 1 million that is on your medical policy. Okay, so they will pay as per that pre-existing sub-benefit. So for example, and it varies actually. For example, one insurance company will charge 400,000 shillings or pay 400,000 shillings for that benefit. Another one will pay 500, 600. So it varies. Actually, the highest I've seen for 1 million cover is about 600, and that's really on the higher side. Okay, so they will cap it to that limit. One time I had somebody say, I have a 1 million cover and I'm very confident I'm going to be admitted, I'm going to be paid for. No, you're going to be paid for up to the pre-existing limit. So it's not the entire 1 million that they're going to pay for you. Okay? So it's very important for you to understand that in your medical policy. There's the overall benefit limit, which is in this example 1 million, and then there's a sub-benefit here that caters for pre-existing and chronic conditions. Very good to note the difference, because even that limit tells you or informs you where you're going to be admitted. Okay, a lot of Kenyans will love going to these top tier hospitals, but with 400,000 shillings, it will probably last you 1.5 days. So it's very good to understand your limit so that you can then make a decision on where to be admitted. Now, the other question I also get is on waiting periods. Why do we insurance companies impose waiting periods? Okay, and I always say this. If we do not impose a waiting period, it will be similar to us walking up into a hospital ward and admitting everybody in that ward, giving them cover, telling them, come, let's give you insurance cover. Insurance is not a charity. I keep on saying that. Me and my friend keep on saying that, and sometimes we laugh at it because I cannot tell you the number of calls I've received. Oh, Munene, my dad has just been admitted. Can I buy that 5 million shilling cover you're telling me about today? It doesn't work like that, okay? Like I said, if we do not impose waiting periods as insurance companies, then it will be similar to us walking up into a ward, a medical hospital ward, and telling everybody, come, let me give you cover, come, let me give you cover, okay? We have to be profitable and we have to survive. If we do that, we'll shut down in the next few weeks. So a waiting period usually ranges from 6 months to 1 year, and it's mainly on this pre-existing and chronic conditions. This diabetes, hypertension, arthritis, asthma, these ones are the ones that we subject to a waiting period. Okay? So it is important for us to understand why we impose these things, because first of all, even treating this pre-existing condition is quite expensive. Yeah? An admission for hypertension cannot be compared to an admission for, say, malaria or pneumonia. It is obviously more expensive. It requires even a specialist. Yeah, so for example, for cancer, we have to use an oncologist. So it is quite costly to treat these pre-existing conditions. And that is why I always advise you, ladies and gentlemen, get your medical cover early, before the event occurs, not after the event.